Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In this video, we're going to make a more long-form video talking about the medication Paroxetine or Paxil. We're actually going to go over the drug monograph today. So this is something, if you're looking to read about a medication, the best way to get all the information is to look at the drug monograph, which you can find on the manufacturer's website. So usually a search by the brand name in Google, followed by drug monograph, and it should pop up for you. All right, let's jump into it. All right, so here we have the product monograph for Paxil. The generic name would be Paroxetine tablets. You can see that the tablets here are available as a 10 milligram, a 20 milligram, as well as a 30 milligram tablet. And these would be paroxetine hydrochloride as the salt. It says here that it's an antidepressant, anti-obsessional, anti-panic. It's an anxiolytic agent, which would be anti-anxiety. It can treat social phobia or social anxiety disorder, as well as post-traumatic stress disorder. Here we have the table of contents. So first will be a summary of product information, indications and clinical use, contraindications, warnings and precautions, adverse reactions and drug interactions, dosage and administration, what to do during an overdose, action and clinical pharmacology, storage and stability, dosage forms, composition, and packaging. Part 2 here, the scientific information. We probably won't go too deep into that in this video, but we might take a look at it depending on how the video goes as we progress. And then there's some consumer information as well. So here we have the health professional information. So the route of administration would be oral. So I said it's available as a tablet. You can see here, again, 10 milligrams, 20 milligrams, and 30 milligrams. I don't think it's too important to go over the non-medicinal ingredients here, but if you're interested in that, just look up the product monograph and take a look at those. So indications and clinical use. So for adults in depression, so Paxil, or again paroxetine hydrochloride, is indicated for symptomatic relief of major depressive disorder, or MDD. Clinical trials have provided evidence that continuation treatment with Paxil in patients with moderate to moderately severe depressive disorder is effective for at least 6 months. So that's what the clinical trials showed in depression. Here we have obsessive compulsive disorder. So Paxil is indicated for the symptomatic treatment of obsessive compulsive disorder, or OCD. The obsessions or compulsions must be experienced as intrusive, markedly distressing, time-consuming, or interfering significantly with the person's social or occupational functioning. Now for panic disorder. So Paxil is indicated for the symptomatic treatment of panic disorder, with or without agoraphobia. Now, panic disorder in the DSM-4 is characterized by recurrent, unexpected panic attacks, i.e., a discrete period of intense fear or discomfort in which 4 or more of the following symptoms develop abruptly and reach a peak within 10 minutes. So, palpitations, pounding heart or accelerated heart rate, sweating, trembling or shaking, sensations of shortness of breath or smothering, feeling of choking, chest pain or discomfort, nausea or abdominal distress, feeling dizzy, unsteady, lightheaded, or faint, derealization or feelings of unreality, or depersonalization, being detached from oneself, fear of losing control, fear of dying, numbness or tingling sensation, we'll say. Chills or hot flushes. Next up, we have social phobia. So Paxil is indicated for the symptomatic relief of generalized social phobia, so social anxiety disorder, a disorder characterized by marked or persistent fear, anxious anticipation, or avoidance of multiple social situations. So an example here would be interacting with strangers, attending social gatherings, dealing with authority figures, and or performance situations. So eating, writing, working while being observed, or public speaking. A diagnosis of social phobia or social anxiety disorder should not be made unless fear, anxious anticipation, or avoidance of social and or performance situations interferes significantly with the person's normal routine, occupational functioning, social life, or causes marked distress. Next up, we have generalized anxiety disorder. Paxil is indicated for the symptomatic relief of anxiety causing significant distress in patients with generalized anxiety disorder, or GAD. Now, post-traumatic stress disorder. So Paxil is indicated for the symptomatic treatment of post-traumatic stress disorder, PTSD. PTSD, as defined by the DSM-4, requires exposure to a traumatic event that involved actual or threatened death or serious injury, or threat to the physical integrity of self or others, and a response which involves intense fear, helplessness, or horror. Symptoms that occur as a result of exposure to traumatic event include re-experiencing of the event in the form of intrusive thoughts, flashbacks, or dreams, and intense psychological distress and physiological reactivity on exposure to clues to the event. Avoidance of situations reminiscent of the traumatic event, inability to recall details of the event, and or numbing or general responsiveness manifested as diminished interest in significant activities, estrangement from others, restricted range of affect, or sense of foreshortened future, and symptoms of autonomic arousal, including hypervigilance, exaggerated startle response, sleep disturbance, impaired concentration, and irritability or outbursts of anger. So again, that would be for post-traumatic stress disorder. A diagnosis of PTSD requires that the symptoms are present for at least 1 month and that they cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. So next here, we're just talking about the long-term use of Paxil. So the effectiveness of Paxil in long-term use, which would be more than 8 weeks for generalized anxiety disorder and 12 weeks for other indications, has not yet been established in clinical trials for OCD, panic disorder, social phobia or social anxiety disorder, generalized anxiety disorder, and post-traumatic stress disorder. Therefore, the physician who elects to use Paxil for extended periods in these indications should periodically reevaluate the long-term usefulness of the drug for individual patients. So again, here see dosage and administration dosing considerations, which we'll get to as we continue on. For geriatrics or patients above the age of 65, evidence of clinical studies indicates that there are differences in pharmacokinetic profile of paroxetine in the geriatric population relative to younger adults, which may be associated with differences in safety and effectiveness. A brief discussion can be found in the appropriate sections, so warnings and precautions. We'll get to that. Okay, so pediatrics, patients less than 18 years of age. So Paxil is not indicated for the use in patients below the age of 18 years. Again, we'll see that in warnings and precautions. All right, so contraindications. So hypersensitivity. Paxil is contraindicated in patients who are known to be hypersensitive to the drug or any of its components. That kind of goes for every drug. Monoamine oxidase inhibitors. So in patients receiving serotonin reuptake inhibitors, SSRIs, in combination with a monoamine oxidase inhibitor, there have been reports of serious and sometimes fatal reactions, including hyperthermia, rigidity, myoclonus, autonomic instability, with possible rapid fluctuations of vital signs, and mental status changes that include extreme agitation, progressing to delirium and coma. These reactions have also been reported in patients who have recently discontinued SSRI treatment and have begun treatment on a monoamine oxidase inhibitor. Some cases presented with features resembling serotonin syndrome or neuroleptic malignant syndrome. Therefore, Paxil should not be used in combination with a monoamine oxidase inhibitor, and this includes linezolid, an antibiotic which is reversibly non-selective monoamine oxidase inhibitor, and methylthioamium chloride, methylene blue, or within a minimum of 2 weeks of terminating treatment with a monoamine oxidase inhibitor. So if you're on a monoamine oxidase inhibitor, stop taking the medication after 2 weeks. It looks like you can use Paxil. Treatment with Paxil should then be initiated cautiously and the dosage increased. Gradually, the dose increased gradually until optimal response is reached. Monoamine oxidase inhibitor should not be introduced within 2 weeks of cessation of therapy of Paxil. So these ones here, I'm not going to read through them. The monoamine oxidase inhibitor one was important. These ones are obviously they're all important, but these ones I'm just going to just see the name here. Thioridazine and Pimozide. So just those are other medications that looks like you can't use with Paxil. All right, so precautions or warnings and precautions. So in pediatrics, placebo-controlled clinical trial data. So recent analysis of placebo-controlled clinical trial safety databases from SSRIs and other newer antidepressants suggests that use of these drugs in patients under the age of 18 may be associated with behavioral and emotional changes, including an increased risk of suicidal ideation and behavior over that of placebo. The small denominators in the clinical trial database, as well as the variability in placebo rates, preclude reliable conclusions on the relative safety profiles among these drugs. So, adult and pediatrics, additional data. There are clinical trial and post-marketing reports with SSRIs and other newer antidepressants in both pediatrics and adults of severe agitation type adverse events coupled with self-harm or harm to others. The agitation type events include akathisia, agitation, disinhibition, emotional lability, hostility, aggression, and depersonalization. In some cases, the events occurred within several weeks of starting treatment. Rigorous clinical monitoring for suicidal ideation or other indicators of potential for suicidal behavior is advised in patients of all ages. This includes monitoring for agitation-type emotional and behavioral changes. So the FDA meta-analysis of placebo-controlled clinical trials for antidepressant drugs in adults, in adult patients ages 18 to 24 years with psychiatric disorders showed an increased risk of suicidal behavior with antidepressant compared to placebo. Discontinuation symptoms. Patients currently taking Paxil should not be discontinued abruptly due to the risk of discontinuation symptoms. At the time that the medical decision is made to discontinue the SSRI or other newer antidepressant drug, a gradual reduction in dose rather than an abrupt cessation is recommended. Discontinuation of treatment with Paxil. So when discontinuing treatment, regardless of the indication for which Paxil is being prescribed, patients should be monitored for symptoms which may be associated with discontinuation. This could be dizziness, sleep disturbances, including abnormal dreams, sensory disturbances, electric shock sensations and tinnitus, agitation, anxiety, headache, tremor, confusion, diarrhea, nausea, vomiting, and sweating, or other symptoms which may be of clinical significance. Events following discontinuation of treatment. A gradual reduction in the dose rather than an abrupt cessation is recommended whenever possible. If intolerable symptoms occur following a decrease in dose or upon discontinuation of treatment, dose titration should be managed on the basis of the patient's clinical response. So it will be different from patient to patient, the way you would deal with that. Paxil treatment during pregnancy, effects on newborns. So epidemiological studies of pregnancy outcomes following maternal exposure to antidepressants in the first trimester have reported an increase in the risk of congenital malformations, particularly cardiovascular, so ventricular and atrial septal defects, associated with the use of paroxetine. If a patient becomes pregnant while taking Paxil, consideration should be given to switching to other treatment options. Treatment with Paxil should only be continued for an individual pregnant patient if the potential benefits outweigh the potential risks. So initiation of paroxetine for women who intend to become pregnant or are in the first trimester of pregnancy should be considered only after each treatment option has been evaluated. Again, we'll see that in warnings and precautions. Post-marketing reports indicate some neonates exposed to Paxil, SSRIs, so selective serotonin reuptake inhibitors, or other newer antidepressants late in the third trimester have developed complications requiring prolonged hospitalization, respiratory support, and tube feeding. Such complications can arise immediately upon delivery. When treating a pregnant woman with Paxil during the third trimester, the physician should carefully consider the potential risks and benefits of treatment. Sexual dysfunction. So selective serotonin reuptake inhibitors, SSRIs, may cause symptoms of sexual dysfunction. Patients should be informed that there have been reports of long-lasting sexual dysfunction where the symptoms have continued despite discontinuation of SSRIs. All right, so potential for reduced efficacy of tamoxifen with concomitant SSRI use, including Paxil. The anti-tumor agent tamoxifen is a prodrug requiring metabolic activation by CYP2D6. Inhibition of CYP2D6 can lead to reduced plasma concentration of primary active metabolite, endoxifen. Chronic use of CYP2D6 inhibitors, including certain SSRIs, together with tamoxifen, can lead to persistent reduction in levels of endoxifen. Some studies have shown that the efficacy of tamoxifen, and as measured by the risk of breast cancer relapse or mortality, may be reduced when co-prescribed with Paxil as a result of the paroxetine's irreversible inhibition of CYP2D6. This risk may increase with longer duration of co-administration. When tamoxifen is used for the treatment of breast cancer, prescribers should consider using an alternative antidepressant with little or no CYP2D6 inhibition. Next, we have psychomotor impairment. So although paroxetine did not cause sedation or interfere with psychomotor performance in placebo-controlled studies in normal subjects, patients should be advised to avoid driving a car or operating hazardous machinery until they are reasonably certain that Paxil does not affect them adversely. Bone fracture risk. Epidemiological studies have show an increased risk of bone fractures following exposure to some antidepressants, including SSRIs. The risks appear to be greater at the initial stages of treatment, but significant increased risks were also observed at later stages of treatment. The possibility of fracture should be considered in the care of patients treated with Paxil. Elderly patients and patients with important risk factors for bone fractures should be advised of possible adverse events which increase the risk of falls, such as dizziness or orthostatic hypotension. Orthostatic hypotension would be a sudden drop in blood pressure when going from a seated to a standing position, especially at early stages of treatment, but soon after withdrawal. Preliminary data from observational studies show association of SSRIs and low bone mineral density in older men and women. Until further information becomes available, a possible effect of bone mineral density with long-term treatment of SSRIs, including Paxil, cannot be excluded, and may be potential concern for patients with osteoporosis or major risk factors for bone fractures. Okay, we'll go over a few more of these here, and then we'll probably move on to the next section. So cardiovascular. So Paxil has not been evaluated or used to any appreciable extent in patients with recent history of myocardial infarction or heart attack or unstable heart disease. The usual precautions would be observed in patients with cardiac conditions. Concomitant illness. So clinical experience with Paxil in patients with certain concomitant systemic illnesses is limited. Caution is advisable in using Paxil in patients with disease or conditions that could affect metabolism or hemodynamic response. Dependence liability. So Paxil has not been systematically studied in animals or humans for its potential for abuse, tolerance, or physical dependence. Physicians should carefully evaluate patients for the history of drug abuse and follow such patients closely, observing them for signs of misuse or abuse of Paxil. We'll skip over cholesterol. Abnormal bleeding. So SSRIs, including Paxil, may increase the risk of bleeding events by causing abnormal platelet aggregation. Concomitant use of acetylsalicylic acid, ASA, non-steroidal anti-inflammatory drugs, NSAIDs, warfarin, or other anticoagulants may add to the risk. Case reports and epidemiological studies, case control and cohort design, have demonstrated an association between use of drugs that interfere with serotonin reuptake and the occurrence of gastrointestinal bleeding. The bleeding events related to SSRIs use have ranged from ecchymosis, hematomas, epistaxis, and petechiae to life-threatening hemorrhages. Gastrointestinal and gynecological bleeding have also been reported following treatment with Paxil. I guess we'll talk here about liver impairment. So pharmacokinetic studies of Paxil in subjects with a clinically significant hepatic impairment suggest that prolongation of the elimination half-life and increased plasma levels can be expected in this patient group. Paxil should be used with caution and dosages restricted to lower end of the range in patients with clinically significant hepatic or liver impairment. So for hypersensitivity, the 10 milligram tablet coating contains azodi and azodi, which may cause an allergic reaction. Epilepsy, as with other antidepressants, Paxil should be used with caution in patients with epilepsy. Seizures, so during clinical trials, the overall incidence of seizures was 0.15% in patients treated with Paxil. However, patients with a history of convulsive disorders were excluded from these studies. Caution is recommended when the drug is administered to patients with a history of seizures. The drug should be discontinued in any patient who develops seizures. This is an important one here, serotonin syndrome or neuroleptic malignant syndrome. So on rare occasions, serotonin syndrome or neuroleptic malignant syndrome like events have occurred in association with treatment of Paxil, particularly when given in combination with other serotonergic and or neuroleptic antipsychotic drugs. As these syndromes may present in potentially life-threatening conditions, treatment with Paxil should be discontinued if patients develop a combination of symptoms, possibly including hyperthermia, rigidity, myoclonus, autonomic instability, with possible rapid fluctuations of vital signs, mental status changes including confusion, irritability, extreme agitation progressing to delirium and coma, and supportive symptomatic treatment should be initiated. Due to the risk of serotonergic syndrome, or serotonin syndrome, or neuroleptic malignant syndrome, Paxil should not be used in combination with monoamine oxidase inhibitors. So we mentioned that above, that drug interaction, that they shouldn't be used within 2 weeks of one another. So this is explaining why. Yeah, so that's pretty much the main point there. I'll skip over glaucoma. Okay, so suicide. The possibility of a suicide attempt is inherent in depression and may persist until remission occurs. Patients with depression may experience worsening of their depressive symptoms and or emergence of suicidal ideation and behaviors, suicidality, whether or not they are taking an antidepressant medication. Notwithstanding, high-risk patients should be closely supervised throughout therapy with appropriate consideration to the possible need for hospitalization. In order to minimize the opportunity for overdose, prescriptions for Paxil should be written for the smallest quantity of drug consistent with good patient management. Because of the well-established comorbidity between depression and other psychiatric disorders, the same precautions observed when treating patients with depression should be observed when treating patients with other psychiatric disorders. Activation of mania or hypomania. So during clinical testing in a patient population comprised primarily of unipolar depressed patients, approximately 1% of Paxil-treated patients experienced manic reactions. When bipolar patients were considered as a subgroup, the incidence of mania was 2%. As with all drugs effective in the treatment of depression, Paxil should be used with caution in patients with a history of mania. A major depressive episode may be the initial presentation of bipolar disorder. Patients with bipolar disorder may be at an increased risk of experiencing manic episodes when treated with antidepressants alone. Therefore, the decision to initiate symptomatic treatment of depression should only be made after patients have been adequately assessed to determine if they are at risk for bipolar disorder. Electroconvulsive therapy, or ECT. The efficacy and safety of concurrent use of Paxil and ECT has not been studied. All right, renal, so kidneys. Hyponatremia, so this would be low sodium levels. Several cases of hyponatremia have been reported. The hyponatremia appeared to be reversible when Paxil was discontinued. The majority of these occurrences have been in elderly individuals, some in patients taking diuretics, or who were otherwise volume depleted. Renal impairment. So since Paxil is extensively metabolized by the liver, excretion of unchanged drug in urine is a minor route of elimination. However, single-dose pharmacokinetic studies in subjects with clinically significant renal impairment suggest that plasma levels of paroxetine are elevated in such subjects. Paroxetine should therefore be used with caution and dosage restricted to the lower end of the range in patients with clinically significant renal impairment or kidney impairment. All right, sexual function or reproduction. So sperm quality. Some clinical studies have shown that SSRIs, including Paxil, may affect sperm quality. This effect appears to be reversible following discontinuation of treatment. Changes in sperm quality may affect fertility in some men. Probably skip over pregnancy. Nursing mothers, we'll skip. Okay, so we mentioned above pediatrics under the age of 18. It's not indicated, so you're not indicated to use in patients below the age of 18. We said here for geriatrics over the age of 65, administration of Paxil to the elderly is associated with increased plasma levels and prolongation of elimination half-life relative to younger adults. So they should be started off on the lowest daily dose associated with clinical efficacy. It just says here for monitoring and laboratory tests, serum cholesterol elevation. So you'd be monitoring your serum cholesterol. All right, adverse drug reaction overview. So commonly observed adverse events. The most commonly observed adverse events, experiences associated with the use of Paxil in clinical trials and not seen at an equivalent incidence among placebo patients were nausea, somnolence, sweating, tremor, asthenia, dizziness, dry mouth, insomnia, constipation, diarrhea, decreased appetite, and male sexual dysfunction. Adverse events leading to discontinuation of treatment. 21% of over 4,000 patients who received Paxil in a worldwide clinical trials in depression discontinued treatment due to an adverse event. So 21% of 4,000 patients discontinued it due to adverse events. In obsessive compulsive disorder, panic disorder, social phobia, generalized anxiety disorder, and post-traumatic stress disorder, 11.8%, 9.4%, 16.1%, 10.7%, and 11.7% respectively of patients treated with Paxil discontinued treatment because of adverse events. So it looks like somewhere between 11% and 21% of patients stopped taking this medication because of adverse events. The most common events leading to discontinuation, reported by 1% or more of subjects, included asthenia, headache, nausea, somnolence, insomnia, agitation, tremor, dizziness, constipation, impotence, abnormal ejaculation, sweating, and diarrhea. Just kind of went over the main points with that, so we'll skip through that. Okay, so this is a good table right here. So treatment emergent adverse events in short-term flexible dose placebo-controlled clinical trials in depression. So these are clinical trials treating depression. They're using paroxetine compared with placebo. These are the side effects that patients using the medication got, where the percentage differences. So you can see here, using the medication, what the percentages are, and on this side, what the placebo got. I'm not going to go through each one. We'll kind of go through the list and name off a few. So headache looks similar. Asthenia, I believe, is abnormal weakness. So 15% for paroxetine, 6% for placebo. I'm just trying to pick out the ones that have high differences here. Palpitation, so 2.9% for paroxetine, 1.4% for placebo. Sweating, so 11.2% using paroxetine, 2.4% using placebo. That one seems to be prevalent. Nausea, another big one, 25.7% compared to 9.3% drug versus placebo. So I'll just quickly read through these side effects just so we make sure you guys have a good idea of what the possible side effects are. So headache, asthenia, abdominal pain, fever, chest pain, trauma, back pain, palpitations, vasodilation, postural hypotension, sweating, rash, nausea, dry mouth, constipation, diarrhea, decreased appetite, flatulence, vomiting, oropharynx disorder, dyspepsia, increased appetite, myopathy, myalgia, myasthenia, somnolence, dizziness, insomnia, tremor, nervousness, anxiety, I never know how to say this word, paresthesia, libido decreased, agitation, drugged feeling, myoclonus, CNS stimulation, confusion, respiratory disorder, yawn, pharyngitis, maybe blurred vision, taste perversion. Finally, here we have abnormal ejaculation, male genital disorders, urinary frequency, urinary impairment, impotence, female genital disorders. So on this table here would be the same side effects, but these are in studies that were treating the indications other than depression. So social phobia, panic disorder, post-traumatic stress disorder. So I guess the dosing would be different, I presume, for some of these conditions. So the prevalence of some of these side effects may be different, but it is the list of the same side effect. And finishing the list. Went over sexual dysfunction. So it's still just going over the main side effects here. Dermatological side effects, gastrointestinal side effects. I don't think there's much value in me going over all these where we just went over that main table of the main side effects. So we'll continue past this. They do have a good breakdown here of side effects. If you're ever looking to just learn about a medication, always remember you can look up the drug monograph, usually by brand name. So for this, for Paxil, and it should take you to the manufacturer's website where you can find the drug monograph. I'm going to try to read through some of these for you guys of popular medications so you can just kind of listen to it while you're doing something else. Drug interactions. Drug interactions, I could go over, but I feel like if you're going to get a prescription for this medication, if you're watching this video and you're getting a prescription for the medication, your pharmacist will check for interactions for you anyway. They don't know how much value it provides giving this to you. And we'll just skip through that. So they're literally talking about the interaction for all the interactive medications. That's a lot to go over. One thing to note here, drug-food interaction, so the absorption and pharmacokinetics of Paxil are not affected by food or antacids. All right, dosage and administration. Just another warning here, the Paxil is not to be used in patients under the age of 18 years old. Lower initial doses of Paxil are recommended for elderly and debilitated patients and patients with renal or hepatic impairment. Paxil should not be administered, Paxil should be administered once daily in the morning and may be taken with or without food. The tablet should be swallowed whole rather than chewed. Based on pharmacokinetic parameters, steady-state paroxetine plasma levels are achieved over a 7 to 14 day interval. Hence, dosage adjustments in 10 milligram increments should be made at 1 to 2 week intervals or according to clinician judgment. Maintenance. During long-term therapy for any indication, the dosage should be maintained at the lowest effective level. There is no body of evidence available to answer the question of how long a patient should continue treatment with Paxil. It is generally agreed that acute episodes of depression require several months or longer of sustained pharmacological therapy. Whether the dose of an antidepressant needed to induce remission is identical to the dose needed to maintain and or sustain euthymia is unknown. Systematic evaluation of the efficacy of paroxetine hydrochloride has shown that efficacy is maintained for at least 6 months with doses that averaged about 30 milligrams. We talked about discontinuation of treatment. All right, so now we're going to talk about the dosing for different indications. So this is important to go over here. So in depression, the usual adult dose. The administration of Paxil should be initiated at 20 milligrams daily. For most patients, 20 milligrams daily will also be the optimum dose. The therapeutic response may be delayed until the 3rd or 4th week of treatment. Dose range. For those patients who do not respond adequately to 20 milligrams daily dose, a gradual increase in dosage up to 40 milligrams daily may be considered. The maximum recommended daily dose is 50 milligrams. Okay, obsessive compulsive disorder. The administration of Paxil should be initiated again at 20 milligrams per day. The recommended dose of Paxil in the treatment of OCD is 40 milligrams daily. Dosage range. For those patients who do not respond adequately to 40 milligrams daily dose, a gradual increase in dosage may be considered. The maximum recommended daily dose is 60 milligrams for this condition. For panic disorder, start at 10 milligrams per day. The recommended dose is 40 milligrams per day. Dosing range, for patients who don't have success with 40 milligrams, they can move to 60 milligrams. So again, a little bit higher in these than depression. Social phobia. Recommended initial dose, 20 milligrams. No clear dose relationship has been demonstrated over a 20 to 60 milligram day dose range. So it says here 10 milligram increments when you're changing your dose, and a maximum dose would be 50 milligrams per day. Generalized anxiety disorder. So the recommended initial dose is 20 milligrams. Some patients that don't respond adequately to 20 milligrams may benefit from a gradual dose increase in 10 milligram increments up to a maximum of 50 milligrams per day. Post-traumatic stress disorder, starting dose 20 milligrams. If you don't respond to 20 milligrams, again, you can increase by 10 milligrams per day increments up to a maximum of 50 milligrams per day. Special populations. I'm going to avoid pregnancy because I just don't want to risk anybody getting their advice from me. With pregnancy, you should always go to your physician for that, for everything, but pregnancy, you should consult your physician for sure. We talked about starting at a lower dose for geriatric patients over the age of 65. Another warning there that you shouldn't use it under 18. Overdosage. The largest known ingestion of which a patient has recovered is 2,000 milligrams. The smallest known dose of paroxetine alone, which alone associated with a fatal outcome, is approximately 400 milligrams. I think this part here is important to go over. Symptoms of overdosage. So the most common reported adverse events subsequent to paroxetine only overdose include somnolence, nausea, tremor. dizziness, vomiting, diarrhea, agitation, aggression, anxiety, confused state, headache, fatigue, insomnia, tachycardia, hyperhidrosis, mydriasis, convulsion, paresthesia, serotonin syndrome, fever, blood pressure changes, involuntary muscle contraction, and loss of consciousness. It should be noted that in some cases, patients have also consumed alcohol in addition to taking overdose of paroxetine. Some of these symptoms may also be seen with clinical use. So again, if you have some of these symptoms, if you took a normal dose, you shouldn't be fearing the overdose because some of these symptoms may happen just with normal dosing. Treatment of overdose. Action and clinical pharmacology. So mechanism of action. So paroxetine is a potent and selective serotonin reuptake inhibitor, or an SSRI. This activity of the drug on brain neurons is thought to be responsible for its antidepressant and anxiolytic action in the treatment of depression, obsessive compulsive disorder, panic disorder, social phobia, generalized anxiety disorder, and post-traumatic stress disorder. Paroxetine is a phenylpiperidine derivative which is chemically unrelated to the tricyclic or tetracyclic antidepressants. In receptor binding studies, paroxetine did not exhibit significant affinity for adrenergic, alpha 1, alpha 2, and beta, dopaminergic, serotonergic, 5-HT1, 5-HT2, or histaminergic receptors of rat brain membrane. A weak affinity for the muscarinic acetylcholine receptor was evident. The predominant metabolites of paroxetine are essentially inactive as 5-HT receptor inhibitors. I guess we can go over some pharmacokinetics here. So we'll start with absorption. Paroxetine is well absorbed after oral administration. In healthy volunteers, the absorption of a single 30 milligram oral dose of paroxetine was not appreciably affected by the presence or absence of food. You can take this medication without respect to food. Both the rate of absorption and the terminal elimination half-life appear to be independent of dose. Steady-state plasma concentrations of paroxetine are generally achieved in 7 to 14 days. No correlation has been established between paroxetine plasma concentrations and therapeutic efficacy or the incidence of adverse reactions. In healthy young volunteers receiving 20 milligrams daily dose of paroxetine for 15 days, the mean maximum plasma concentration was 41 nanograms per milliliter at steady state. Peak plasma levels were generally occurred within 3 to 7 hours. Distribution, metabolism, we'll skip this. Elimination. So following the single or multiple dose administration of paroxetine at doses 20 to 50 milligrams, the mean elimination half-life value for healthy subjects appears to be about 24 hours, although a range of 3 to 65 hours has been reported. Approximately 64% of an administered dose of paroxetine is eliminated by the kidneys and 36% in the feces. Less than 2% of the dose is recovered in the form of parent compound. Special populations. So we talked about geriatrics. Skip over renal and kidney. Steady state pharmacokinetics after paroxetine after doses of 20 milligrams daily. So we'll just talk about the half-life here. So in young healthy subjects, 19 hours. So the half-life, the time here would be the amount of time it takes for the concentration of the medication to decrease by half in your body. So after 19 hours, it would decrease by half. In elderly patients, that's up to 31 hours. And people that have impaired liver, it would be 66 hours. Again, there for higher dose. Storage and stability, store at 15 to 30 degrees. We talked about it's available as 10 milligrams, 20 milligrams, and 30 milligrams. If anybody's interested, I guess there's the structural formula. Paroxetine hydrochloride. Probably going to skip over this. I think we're going to skip trials. I don't think that's too important. Go over trials of when it was treated, of how they treated it in trials. Animal studies. Bear with me for a second here. I'm just scanning the lower end of the. We may be done here, but I'm just scanning the lower end of the doc. Yeah, we're at references now, so that'll do it for the review of the drug monograph. Again, I'm going to make a couple more videos like this moving forward. But as always, if you enjoyed the video, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. And I guess that's it. Take care.